Okay, I'll get going. Welcome to this joint webinar between the Council of Deans of Health and the Association of Colleges, looking at partnership working across the further education and higher education sectors in delivering healthcare education. I'm Namita Srivastava, Policy Officer at the Council of Deans, and I'm jointly hosting this webinar with Ian Munro, Director of Sustainability, Health and Care at the Association of Colleges. We're also welcoming speakers from further and higher education, giving great examples of partnership working between FE colleges and HEIs from Sheffield, Suffolk and Worcester. These are case studies of local partnerships, as many of the challenges and solutions to shortages of healthcare professionals are local, where local NHS employers are working with colleges and universities to identify where jobs may become available. A college may provide more accessible education pathways to provide local people with opportunities to train towards those jobs, particularly in underserved communities. I'll pass on to Ian shortly, but firstly, I want to bring in James Hallwood, Head of Policy and External Affairs at the Council, to say a few words about the partnership between the Council of Deans and Association of Colleges.
Thanks, Namita. I'm going to keep it really snappy because you're not here to listen to me. I'm really looking forward to listening to those case studies. It's just to say that it's great to see such a great turnout for a session like this. And it really speaks to, I think, the evolution of the council's work and our thinking on that partnership over the last few years. So it's really great for us to work with our friends at the Association of Colleges and work with our members who we know work across these multiple strands. It does feel like how we think about healthcare education is changing in really quick kind of real time way now. And I suppose for us, it's just trying to keep pace with that, listen to you, learn from that. And I know that there'll be lots of people who will be joining this, who'll be thinking about the evolution of their own courses and what they can get from this as well. So please, the only thing I'll quickly say is if you have questions, there's a Q&A box at the bottom. There is a chat box, but if you put questions in the Q&A, that's much easier. And then we'll come to them at the end of the case studies as well. So I know there might be some interesting thoughts that you have, or maybe some examples from your own work that would be happy to share as well. But I'll hand straight back to Namita then, and then hand over to the speakers. So thanks again for joining us.
James, as James says, please do enter your questions in the Q&A function, and we'll come to the end of the case studies. So firstly, I'll hand over to Ian Munro. So please, Ian, go ahead. Ian, are you on mute?
I am. Apologies, colleagues. There were so many things to switch through there. I've got there in the end. Welcome. And just to echo that welcome from James and Namita, it's an absolute pleasure to be working with our colleagues at the Council of Deans to not only push forward the great collaborations that both FE and HE are doing to solve the crisis in staffing in the healthcare sector, but also to celebrate these fantastic case studies. And we have 12 brilliant case studies, only time today for a few, but I hope we can find more time in the new year to showcase those other brilliant case studies. They are very, very important examples that we can use with government departments, officials and others just to show what can be done. So I'll just try and move forward, which it's not doing. There we go. The context, colleagues, you'll all know this from the long-term workforce plan. Lots of big numbers in there, of course, a huge challenge for the NHS and the health and social care sector. And I think we've all been looking at this in the ways that how we can contribute and help. But, you know, that was a year ago that was launched. And I think our concern in FE and HE is, well, what progress has actually been made in that time? And as each year goes past, those statistics and the data only gets more and more worrying. What we do know that we do need a more proactive way of working, maximising apprenticeship models, for examples, progression from level 2, 3, 4 and through. And the pipeline, talent pipeline, call it what you like. There's plenty of phrases come out from the NHS on this, but whatever it is, we have got to grow that talent and we've got to encourage more and more people into this brilliant sector. At the moment, I think we're entering a really interesting phase of opportunity for HE and FE to work together, and partly driven, I think, with the new government and its 5 missions. You'll have no doubt seen these, and these are bringing into quite sharp focus now the areas that the government want to kickstart the economy, make Britain a clean energy power, take back streets and the breakdown to barriers and opportunity, but particularly build an NHS for the future. So it won't surprise you that AOC, Universities UK, Council of Deans, we've all been thinking how we need to continue to work with ministers and government officials to press the case for a more streamlined, more effective system in the NHS, and particularly around education and training. On Monday, you may have seen it, colleagues, AOC, we launched our report, Mission Accepted, the role of colleges across the government's 5 missions. I've put the link there, you may well be interested in that. We've been working on this for some time, trying to distill down what it is that colleges can do to support those missions in their localities. And obviously, the one that interests us most today, colleagues, is around building an NHS fit for the future. And I've just popped in a few quotes, which is often better than me reading things. So there's our chief exec, some of the words David Hughes has said, but also Matthew Taylor from the chief exec from the NHS Confederation. And Matthew's very strong on the role of colleges and how we can work with the NHS in our localities and secure that pipeline and demand. And you'll also see Baroness Smith, the new Minister for Skills, who spoke at our AOC conference in November, again highlights the key role of skills, a new way of working, new processes, new systems to streamline things and make things happen a lot quicker. And you'll see in her quote very much about the NHS. So, colleagues, I think we do have an opportunity to influence, and we'll only do that by working closely together. The second thing I want to just raise, and you may be aware of this, is the new formation of new funding body called Skills England. And again, we need to work with Skills England to make sure that the funding is channeled into those key and priority areas, and particularly for us in around healthcare. We know the impact healthcare has on our regions in so many different ways, and we all work very closely with partners in those regions to do the best we can. But we definitely need more streamlined, simpler funding systems and much more investment. And I think working together with Skills England, we can influence there too. So I do think we've got great opportunities, colleagues. Through our HE partners and our FE colleges together, we can do this influencing and press home the case. FE and HE has been working together as long as I know. I mean, I've been in the education sector for some 25 years. And when I first came into further education, my first jobs was working in partnership with a number of universities to create almost a hub and spoke model, and those things haven't changed. I think we all do great work. The case studies really show that. As Sir David Behan said when he was chair of Health Education England, and now obviously Office for Students, that the relationship between the NHS, the local health and care systems, HE and FE, is absolutely crucial to the current and future workforce needed. And we know that we just need a system that enables us to collaborate. And I think that whole pipeline and local access is one of the fundamentals of attracting a much more diverse population into the health and care sector. So if we just turn very briefly to the case studies, some of the themes that emerged from the 12 case studies, and Namita did some great work pulling out some of those themes. And none of this would surprise you, colleagues, that what makes those FE-HE partnerships work in a locality is understanding that if you study local, you're more likely to stay local, and therefore you're building capacity at a local level to support the NHS. That you can work together to address skills shortages because you can move fast and quickly, and FE-HE in their localities know what those demands are through their relationships with the NHS, and they can plan. But planning for workforce demand is still a major challenge. And you can see a number of other themes there, colleagues, rather than me reading them all out, how these partnerships work really effectively. Final bullet point, of course, ultimately is to increase application and conversion rates, because very sadly, too many young people enter or study towards qualifications in health and social care, but the attrition is quite high. They do not stay, And that seems a real waste of talent that in those initial stages of joining the healthcare sector, they leave. So there's lots in there. And these are some of the themes that underpin why HE and FE partnerships are so important, because they can support those students through mentoring and in their placements. And hopefully they will then enter the workforce and stay for a good long time. Lots of really key points. That there were many that we heard from colleagues in the case studies around the collaboration and what makes it effective. And I think the top one, really having that shared commitment, the vision aims, and embedded at the center of the collaboration is fundamental, that everybody understands. And it is very much about leadership, both at senior level, at vice chancellor level, principal level, but right the way through the college or the university, and understanding that there is a much bigger picture here, and that the sum of the two parts will help us deliver fantastic training and education opportunities. Many other things there you would expect and will make sense. And of course, we have various regulatory bodies and inspection regimes that we have to work with and through. And naturally understanding both the FE Ofsted and the higher education quality control mechanisms, and making sure that we get those right so that there is confidence in the work and the partnerships that we're doing. And the final point there, it's a meaningful partnership with aligned strategic objectives that therefore both institutions can work through. So that's a brief introduction. And I just wanted to briefly set the context. What's much more interesting today, colleagues, is to hear about these exciting case studies. And I'm really looking forward to hearing what colleagues have got to say. So Meeta, I'm going to pass back to you.
Thank you very much, Ian. That was and the council and the Association of Colleges are doing some excellent work in influencing the healthcare workforce pipeline and collaborating with colleagues on that. So that's wonderful. So thank you very much for that. Please do, I'll remind you of the Q&A inbox. So please do put any questions in the Q&A inbox. I'll pass on firstly to, we'll look at Sheffield. So we'll pass on to Claire Stanley from Sheffield Hallam University and Sam Wilby from Sheffield College, who are going to give the presentation about the partnership there in Sheffield. So there you go, Claire.
Thank you. I shall just share my slides. Afternoon, everyone. So yeah, I'm Claire Stanyland. I'm from Sheffield Hallam University. I'm Associate Head of the School of Health and Social Care, and I look after academic partnerships, so UK and international. Sam's going to come on and talk in a few minutes. So Sam is one of my college partners from the Sheffield College, as she leads the programme there.
Thanks, Claire.
Okay, so this slide is just to kind of we've got a couple of slides to give you a little bit of context about our particular programme. So the programme which we are a collaboration on is the Foundation Degree Assistant Practitioner Health and Social Care. And we've been running that together with our college partners since 2016. So we've run it as a foundation degree, and we also run it as a higher apprenticeship. Since 2023, it's also been a higher technical qualification. So it runs in lots of locations. So you can see around the slide, I've put on all the logos of all our current partners. So we've got sort of 7 partners, if you like, but within those partners, they have kind of different colleges that have merged together. So we're currently running in 10 locations, and we run it 2 to 3 times a year, and we also have an online program as well. So it's quite a large franchise, quite complex delivery. This slide was just to give you a bit of an idea really about how I suppose it's one of our benefits of our collaboration is our progression pathways. So the core qualification is the foundation degree for the assistant practitioner route, but we quickly found within a year or so that actually some students wanted just to do level 4 and then step off and maybe go to join level 4 of degrees. They might be learners who've just not met their UCAS points, for example. So we introduced, as part of our foundation degree, a one-year qualification as well. So that's why we've got over here, we've got a certificate of higher education, we've got the higher technical qualification and the higher apprenticeship in this foundation degree group. One of the real pluses about our programme, and I think a benefit of this collaboration, is that we've got the progression routes. So for our learners completing foundation degree sort of have a special application process to apply for entry at year 2 of some BSc programs and also some degree apprenticeship programs, and we also have guaranteed places in a top-up degree to make it up to a BSc in health and social care. If they go on and finish the BSc, then they've got opportunities to go on to the pre-reg masters programs in health and social care, or also other masters programs. So this is just something, we love the flexibility of our programme. Learners often join us, sometimes they know exactly what they want to do, maybe they want to do nursing, allied health, social work. Sometimes they just know they want to do something in health and social care, but the flexibility of our step on, step off direct entry routes allows them to kind of make decisions as they move through the programme as well. Or even if they just want to do sort of more managerial roles, then they can step off at the end of the foundation degree or do the generic top up. So lots of flexibility, lots of options, and happy to answer any questions at the end. I know I can't go into too much detail. So how it was developed, so Sam and I were just kind of reflecting back, because I think both of us were there from almost the beginning. I think I came in about 2017. So we were just looking back on how it came about, really. So from the early 2000s is where the assistant practitioner role developed. I'm assuming most people will know what that is because you're health and social care, but from our point of view, it might be people working in sort of nursing settings, allied health, social work settings. So just that step below a qualified professional. And I guess what you were seeing back then is inconsistency in levels of knowledge, skills, experience and qualification. So in 2016 is when the assistant practitioner occupational standard was developed in the Institute for Apprenticeships and Technical Qualifications. So this is where they develop some knowledge, skills and behaviours around that occupation. And I guess around that time, it was around trying to develop some consistency around what does an assistant practitioner look like? What is it that they know? What can they do? How do they behave? And then the foundation degree or higher national diploma is the qualification it was set at that you had to have alongside the apprenticeship or for now a higher technical qualification. So I guess working with our FE college partners, we identified a regional skills gap, and then we worked together to design a foundation degree alongside our local employer partners. And then that was approved for delivery at the original partners, which wasn't all of those people on the first slide. It was 5 originally, but it was Sheffield, who Sam is here from today. And then we moved on to planning the course, developing assessment briefs together, thinking about session plans and indicative content. So it's all been very collaboratively developed, designed and then implemented. Up to more recently, so this academic year, we've developed a South Yorkshire partnership agreement where with our college partners, they have the kind of oversight of level 4 and level 5 qualifications, and then we have more level 6. Kind of linked to that, we've got our South Yorkshire Institute of Technology, which is hosting higher technical qualifications and apprenticeships, and we've also been working together on bidding for sort of skills injection fund monies, which has really enhanced the equipment and resources that we've had around our college partners. And what Sam and I talk a lot about is our community of practice, and I know Ian mentioned it on your slides before. I think all of that working together and that developing this programme, what it's evolved into is a community of practice. So you'll hear us talk about that on a few of the slides. So we were asked to just talk a little bit about the strengths and the challenges around our partnership. I think from a strength point of view, I think there's really strong leadership in our collaboration. It is very collaborative, and we talk a lot at Sheffield Hallam about our work with college partners being sort of a mutual respect, equal, not a parent-child type relationship. But from our point of view particularly, I think Sam would agree with me, it's the reason why we work so well is because we support each other. We've developed our own friendships and relationships and that network across all of the different colleges, working together and supporting and buddying each other. And you also mentioned, I think both Namita and Ian mentioned about this vision, and that's definitely something that's really, really important to us, which Sam's going to talk about on the next slide. I think having those progression pathways there as well, so that there's kind of links between FE and HE. And we've also done a recent project looking at recruitment and how, from a university point of view, we can support recruitment at college as well. So where learners aren't meeting perhaps our interview level criteria, where we can refer people to colleges and then bring them back in through the system. Because one of the nice widening access or social mobility parts of our course is it's much lower UCAS points. It's only 48 UCAS points, but by the end of our course they're all prepared and really ready for our university study, so it brings them up for physio, occupational therapy, nursing levels by the time they finish. Some of the challenges we've had, so we have had challenges around recruitment, and sometimes it's difficult. We've got quite a few college partners, some of them are quite geographically close, so sometimes that can cause challenges. But again, what I see from the colleges is perhaps a student rings Barnsley up and they're looking at doing the course, and the course lead will ask where they're from. They say they're from Sheffield or Rotherham, and they're like, oh, you know, we've also got a course running there. So that we kind of see ourselves as one big team now, which is really, really lovely. From a management point of view, it's quite complex because of all those different cohorts and all those different partners, and it is quite a large size. I guess from a college point of view, we've talked a little bit about the inflexibility of it over the years, because obviously we design the course at Hallam and we franchise it out to our partners. So we basically say, you need to run this module in these months, and this is your assessment date. And sometimes college partners would prefer maybe to run a module at a different time of the year or have their own assessment date. So we kind of drive that inflexibility a little bit, but it is kind of really driven by efficiencies. Sometimes challenges around communication, engagement. We very much rely on people being able to attend our regular face-to-face meetings, which Sam's going to talk about. So we meet together monthly. We also have a Teams site which we use for communication, but we need people to be able to have resources to attend those meetings or engage with resources or minutes and things that we've shared afterwards. So we just thought it might be quite nice to just talk about some of our top tips, really, about how to develop a successful collaboration, which is what we feel like we have. Sam's just going to come on this slide.
Thank you, Claire. Hi, everybody. So I've just got the list, which kind of echoes some of what Claire said and also reiterates what Ian said. These are what we thought would be our top tips for a good community of practice and a successful collaboration. So where possible, we do meet in person now. We meet monthly. However, there is a facility if someone is teaching that they can join online for a period of time. We have had some blended kind of sessions, but more often than not, we're face-to-face now. Claire and her colleagues come and visit the colleges and talk to our learners, and our learners actually have an opportunity to go to Hallam to do progression events and successful interview technique strategy sessions. We've also more recently done some kind of college road shows. For example, we went to see Doncaster's animatage table at the last community of practice. So it's as a training kind of experience as well as our kind of digital technology needs change. We meet regularly and we meet socially as well. We've just had a Christmas afternoon COP, which was really nice. And in summer, we go for walks together and we have picnics sometimes, weather dependent. As Ian has also reiterated, the shared vision is key. So we share the strategies across the franchise. Obviously, we're passionate about education for all. We want to make an impact across the social demographics and the polar quintiles, and ultimately want to support social mobility. So that's key to what we do and why we do what we do. We collaborate, as Claire said, we co-create resources and we put those in a shared repository, which is well managed by Hallam. We have opportunities to do CPD together, which occasionally we will do at the community of practice. Just very recently, I've been part of the Equity Accomplished training, which has been a great experience and isn't necessarily available to all people. And that is something that is really pivotal in our collaboration, because across the franchise, we are reaching a wider demographic. So all of these CPD opportunities support skill development, innovation, digital skills. And Claire's also said about the MS Teams site. So there's been the development of a communication channel with all the resources available locally for people to access. There are the assessment briefs, there are all the benchmarking and associated paperworks. We can find everything. It's very easily accessible, and Claire manages that, although she's moved job recently, and there's some new collaborative leaders. We learn about each other's kind of like demographics. We share problems, we problem solve. We know that we've got different types of learner because of the slightly different nuances to the demographics of the different franchise colleges. But ultimately, we work together to provide opportunities for development of the community of practice as well, because as Claire said, some of us have been here longer than others. And as the franchise grows, there's opportunities to buddy up. So, for example, I've been there since quite near the start. So I will often help other people as they come on board and join the community of practice. I think Claire's leadership is amazing. The one thing that is brilliant about our community of practice is if we email with an issue, we get a response very quickly. So that communication and that relationship is pivotal.
Thank you, Sam. Can I ask you to wrap up there, because we've got other colleagues to speak as well. So if I can ask you to wrap up very quickly, please.
Okay, so just moving on down, just joint work, everything Claire said. Ultimately, we celebrate together, we celebrate the success and very much appreciate our relationship, and we impact the sector in a positive way.
Thank you very much, Sam and Claire. That was really, really interesting to hear about your shared vision and collaboration there. So I'll pass on to Sam Chenry-Morris and Mandy Surratt from University of Suffolk, and Adrian Denby from the College of West Anglia.
Lovely, thanks. And while Felix is doing it, but two of the things you just said there were fantastic. The mutual respect, because we definitely have mutual respect for our West Anglia and other colleagues. But we don't have any picnics yet. So I was thinking, or maybe we should put that on our list. But anyway, I'm Sam Chenry-Morris, as Namita said. We collectively, the three of us, are presenting about the East of England Centre of Excellence for Health Apprenticeships, a collaboration between HE and FE. We're only presenting one of our colleges, which is the College of West Anglia today, but you'll see, next slide please, Felix, that there's more partners there. So the University of Suffolk, Suffolk New College, which is also in Ipswich, so right next door to us. East Coast College, they have two campuses, one in Lowestoft and one in Great Yarmouth. The College of West Anglia, which is in Northwest East Anglia, supported by two integrated care boards, so Suffolk and North East Essex and Norfolk and Waveney. So we're an innovative partnership originally aimed to further the delivery of apprenticeships in the field of health and social care, similar to our colleagues in the East of England region. Our region is rural and coastal, and we've got many challenges, including high levels of economic inactivity, high level of need and poor opportunities for young people who live here. But also we have the national context of some staffing challenges in relation to the retention and recruitment of health and social care staff. So we're working together to try to address some of these. Next slide, please. So the original proposal for the Centre of Excellence for Healthcare Apprenticeships was made to Health Education England, now obviously NHSE, in 2022, and we secured funding in 23. But it took a while to get the people in place to start the project. So the official start date was February of this year, which aligned with Mandy, the Centre of Excellence project manager, coming into post, and then funding is for 2 years thereafter. Sorting out the governance was our first key challenge, really, setting up a project board, an operational group, and then having a collaboration agreement, and that took a couple of months. Next slide, please. So the aims of our project are to support the expansion of learners enrolled initially on health apprenticeships, but actually this is expanding as the project goes on, and we've been talking to employers as to what some of their needs are. And actually, although we were initially focusing on nursing affiliated provision, the appetite for that has diminished slightly, but actually there are other appetites. And Claire and Sam talked about the assistant practitioner. We've brought that back, for instance, because it's filling an AHP need rather than a nursing need. The other aim is to build strategic workforce capacity across the 2 integrated care systems, engage with FE colleges and healthcare academies across the systems to identify and promote health to all levels of learner. So much, as Ian said, from level 2 all the way up to level 7. Act as a pioneer, showcasing the benefits of working in partnership, and also maximising the impact and the uptake of health careers, providing this one-stop shop, as I've just said. So now we're going to hand over to Adrian, who's going to talk about the College of West Anglia, but our other colleges are also offering lots of exciting work as well that fits into this, and then we'll follow up with Mandy.
Thank you, Sam. Hi, I'm Adrian, from the head of the School of Nursing from the College of West Anglia. And I'll just go to my slide. Thank you. So we're working with the Centre of Excellence for Health Apprenticeships with UOS and other partners. And I just want to say that the School of Nursing Studies was a recent innovation. It was from the Department of Levelling Up grant to address issues of workforce and local opportunities for health and social care in the area. It's an economically deprived area as well. The college is well established. It's nationally commended from City and Guilds, rated good by Ofsted. And with a modest investment, we've managed to create excellent facilities at a local level. And I just want to say that, it is timely. We have, great local aspirations to get into health and social care. As a high elderly population, great needs across the different sectors, and the usual workforce challenges. We have an excellent and broad demographic amongst our learners. And as you'll see, as I put here, we're trying to align our strategic arc, if you like, with the NHS long-term plan, and also those government missions, including creating better local opportunities and reducing barriers to development, as well as supporting the NHS. Our existing offers that we have here stretch across these particular levels, and we have around about nearly 350 learners across those who pass through the School of Nursing Studies as well, and we also have access courses as well. As you can see, there are age ranges from 16 to 62 currently, and this includes people who are going into who want to go into everything from medicine to paramedicine, midwifery, nursing, and such like. So we already have, a great demographic. There's a hunger to get into health and social care, but cost of living crisis and other constraints has meant that people don't have the opportunity to travel. So here's a really timely opportunity for us to provide those facilities in a partnership. And if you wouldn't mind going to the next slide, please, whoever's on the button. Thank you. So we already have a great demographic. We have a good success getting people onto onto higher education degrees. What are we doing now? Well, we're working with all of those. We've married this up with the Apollo project. I have a small team here working at the School of Nursing Studies. You can see some of our statistics in the last year alone. And it's proved popular. Interventions like the Work and Learn have enabled us to reach out, provide enrichment for existing learners, to start new courses from people further from employment. We're actively working with some of the less well represented demographics. We've started courses to get people onto the pipeline, if you will, as well, and that's already borne fruit in the number of people who've gone on to get in the interim jobs in health and social care. They've gone on to our other courses. So we know that there's these feeder routes, if you like, can start really early. And that's where we're starting to put, or where we continue to put much of our focus as well. So we really are trying to stretch across those demographics. I also recognize that if you like, the pipelines start very early. I don't think it can start too early. We have a really robust program where we liaise with schools and academies in the local area. They come over, they use the facilities, we go there. We've also just started the first Royal College of Nursing Cadets as well. It's extremely well attended. There's great interest. And here's another opportunity where actually you're exposing learners to, or potential learners to, some of the different jobs out there. Yes, it's nursing, but many of those aspire to go into midwifery, for instance. So we're really putting some focus through Apollo with good results into across those demographics and pragmatic interventions. And as you can see, we have a large number of schools and academies and employers who we actively consult with to find out what the local workforce need to bespoke engineer, if you like, our offers to where that workforce need is. And if you wouldn't mind going to the third slide, please. Thank you. So it's a short space of time to try to sell our achievements and aspirations. I just want to say also, I've had 37 years in the NHS. My conviction is that people, where they can train locally, identify with it, it engenders loyalty as well. And also people are likely to stay. I think if you build it, they will come. And with our future plans, we want to build on just that. So we're now looking at this level 2 and 3 apprenticeships. There's a great need for those. See that a great number of the workforce at the moment, the health and social care, don't have level 2 qualifications. We're trying to address those and propel people along those routes and hopefully into higher education. There's a great need for dental courses in the local area. We're looking at those as well, and hopefully partnering with our colleagues at University of Suffolk to facilitate this. We also recognise across workforce that there's a need for CPD offers, not currently offered locally, and actually a demand for face-to-face learning rather than simply online. We have great blended learning facilities. We're mobile, we're creative, and so we can bring this into the mix to really support the SEER objectives. Said there, the adult health and social care certificate too. We're looking at skills boot camps as well. And the Apollo project will continue to grow. We're working with armed forces. We're working across those different sectors to identify where the needs are. And this project will really help those local aspirations. There's great ambition. People don't always want to travel. And here's an opportunity to marry up our particular strategic ambitions to serve the local community. And thank you. I'll stop there. I don't want to go over time.
Thank you. So it's my turn next. So next slide, please. So obviously with most projects, you will sort of notice that there's generally some barriers to success, and we have encountered a few. So obviously the triple lock-on recruitment, unfortunately, has had a knock-on effect with, although we've got the long-term workforce plan in place, people are unable to actually recruit to apprenticeship posts. So we have, as Sam has alluded to, had a decrease in numbers on apprenticeships, but that doesn't mean we've actually not had lots of interest. So we are aware that sort of once people are able to start recruiting, we know that the interest for apprenticeships is definitely there. There's been a lot of confidence knocking due to the change of government within the system. And again, a lot of our employer partners are hesitant in putting people onto apprenticeships, wondering what is coming next. Is there something better? We have noticed in the last couple of weeks that there seems to be a slight upturn now in confidence, but that has had a knock-on effect currently with the programme. With the potential removal of the level 7 qualifications, as University of Suffolk, we had developed some level 7 programmes. We had developed a health senior leadership a qualification, and obviously that is one that they keep talking about being removed. and we have been asked by employers to develop these. So lots of time and energy has gone into developing potential level 7 qualifications. So those qualifications are currently on hold. We're looking at sort of developing different programs that our employer partners have asked us to do. We've developed things, and then when it actually comes to recruitment, they're not able to then actually give us enough numbers to make the cohort viable. So it is how we are going out and working with other employers, and if we can get 1 or 2 from other employers, how we can then make those cohorts bigger. There's also, when I'm working with the FE colleges, a lot of our potential apprentices of the sort of the 18-year-olds are saying that there is no visibility of a health apprenticeships. Our employers are not actually advertising for apprenticeship jobs. What they expect staff locally to do is to take a job as a healthcare assistant primarily, and then follow through through their sort of health and social care academy within trusts, and then once they've then completed that, then they can apply for an apprenticeship. So they would actually be an internal candidate. So
thank you, Mandy. Thank you.
No,
If I stop you there, sorry, I
Yeah.
need to move on to the next
Yeah.
speaker. So thank you very much. Thank you for that interesting collaboration, and it's really interesting to see the range of demographics that you reach. I'll pass on to Sally Moyle and Mick Donovan from the University of Worcester.
Thank you. Everyone can see that, presumably. Yeah, great. Okay. So there should be 3 of us here. Myself and Mick are here from the University of Worcester. Neil, who's our partner in Dudley, is sunning himself somewhere nice. So unfortunately, isn't able to make it today. So we're just going to share a few of our journey. When we can. Don't want to move on now.
Sally, I had to use the return key on my keyboard. I don't know if that'll work for you.
No, it isn't working. Oh, hang on. Let's see if I can just go like this. There we go. I'll just do a different thing. Okay, so we'll just talk through the journey so far. So in September 2020, the University of Worcester won a bid to be the higher education partner for a university centre based in the West Midlands. And this was a bid that we put into the Towns Fund, and other universities also put in. And then by the very next month, in October 2020, we were appointed by Dudley Metropolitan Borough Council, DBMC, and the Dudley College to come together to lead a bid towards the DMBC for Towns Fund of 25 million, which was awarded in January 25. So we're really pleased at that stage to be awarded that. And as you can see, 21 to 24 was quite slow progress. So there was a lot of activity at the start of the partnership, and obviously we're in the middle of COVID then. And then in about September 2022, November 22, things really started to take off in terms of the partnership. We had some delays with some of the building work that was going on in Dudley, but we managed by about 2 years ago to start to really think about the partnership, and I'll talk a little bit more about that in a moment. So September 24, we developed our partnership increasingly, and we started delivering out of the Marches IoT, and we'll talk a little bit more about that when I go through the process of how we got there. We have a building being complete. The builders are on site and putting the building up, and we have that will be complete by March 2026. So in the meantime, we are delivering our partnership out of the IoT. But in March 2026, there's a building next door which we'll be moving into. And I'll tell you a bit more about that in a moment. So the collaborative approach that we have, these are all our partners in this particular instance. The idea of the bid was all about supporting social mobility and growth in and around Dudley, with an emphasis on health. A bit like others, it has expanded outside of health, but it really fulfills the agenda of cold spots being Dudley, people wanting to stay in region, upskilling local people and delivering where the local need is. So our partners, of course, are ourselves, Dudley College. We collaborate with our NHS partners. They are always at the table with us when we're talking about what programmes we need, what pipeline we need, and alongside the Black Country ICS, ICB. Dudley Borough Council are always at the table, as are the West Midlands Combined Authority and the Institute of Technology. So it's really quite a big collaborative provision that we're working with. So far, where we are at the moment, over the last couple of years, we've put in place some really strong governance arrangements, both internally and externally. So we have an internal board at the University of Worcester to make sure our staff are developing programmes and that we're recruiting students. We also have a joint board with Dudley College, and we also have then a wider board with the Borough Council and the authorities. One of the biggest things that we feel is our strength is our positive relationships that are built over time. I think because it took us quite some time to get going, we really have built a positive relationship with Dudley College. And as other colleagues have said, that mutual benefit has really helped those positive relationships. We are all trying to achieve the same thing. We have shared values, we have shared ambitions. We really all want students in that region to have access to higher education, and that's been really helpful. So we have helped design the building. We've designed the new building collectively, and we monitor that over time collectively. We look at furniture and all the internals of the building we're doing as a joint venture. One of the most important things I think around a strong partnership is senior input from both organisations. Mick is on the board of the IoT, he's on the board of the Towns Fund Council. So having that senior input from both organisations. Neil is the principal of the college and he's heavily involved in all of the operational and tactical and strategic discussions. And it's the same on our side. We have like a buddy at all levels across both institutions to make sure those that are delivering, those that are developing, those that are having that strategic oversight are having those connections at every level. So I think they're sort of some of the really important points that make the partnership so far. The challenge is it has taken a long time. There was some delays over the building work. There was some delays with building regs and some local residents not wanting some buildings to be knocked down, some old cinemas and things. So there was some time taken over that, plus COVID, of course. And stuff do change over time. So whilst we've had some people who have been in it right from the start, Mick and I joined this project 2 years ago, and Neil from Dudley has been in it right from the start. But stuff do change, so it's about upskilling those staff and getting them on board. The risk appetite from both organisations, I think, is just worth flagging. Because we have a new building and we need to fill the new building, we need to make sure it's viable. Dudley College want to make sure it's viable, as do we. So we have some risk appetite issues over both organisations, but as others have talked about, we sit down and talk about that together. We go through this step by step. And 2 years ago, we didn't know if we were going to get students in the building. 2 years on, we do have students in the building at the moment, which I'll come to in a moment. But what with the financial climate, the downturn in people wanting to do nursing, the risk appetite from both organisations was a bit of a sticking point for a little while. But we have managed to move past that. We've got contracts in place and we're on that journey together. So whilst the slow burn has been a challenge, I'd also say it's probably been a bit of a positive for us because it's enabled us to take it slowly. So what we're doing, so what we are now delivering is the BSc Nursing out of the Marches IoT from September 24. We will deliver in spring other programmes such as the Nursing Associate Apprenticeship, We will also be looking to deliver the nursing, the degree apprenticeship out of the building from next September. We've developed a suite of allied health apprenticeships, which we will also deliver in Dudley from September 25. And we're also then looking at other programmes that might want to be delivered in Dudley to reach that local need of upskilling. For example, we're looking to develop sports therapy, criminology courses and CPD courses for not just the NHS, but also local employers. One of the key things that's really helped us get those students, get the student numbers and keep that kind of movement is the appointment of a recruitment outreach manager. So she works for us, but she actually is based in Dudley and does a lot of the outreach and the employer engagement. And that's been really, really helpful. So by 2026, the building, which you can see there, will, I think it's only a picture of it, will be built, and then we'll be gradually moving our students over into the building. So just to finish, I'm just going to ask Mick, who's been in this partnership the longest and spends most of his time on this partnership, what his key 3 reflections are of building such a strong partnership with Dudley.
Yeah, I agree with all the points raised by previous speakers about partnership working, but the 3 for me have been, there's an incentive for all partners to be successful, so ourselves, the council and the college, there's something in it for all of us. The second thing is we all need each other in order to be successful. No one can work in isolation. For partnership work, you cannot afford not to support your colleagues, and there are clear and measurable goals, and everybody's been held accountable for that. And if anyone's struggling at any point, then the other 2 partners are keen to step in. So fingers crossed, but we're in a good place.
Thanks, Vic. Thank you.
Thank you very much. I look forward to the building being open. It was really exciting, so that looks great.
Oh, wait. Yeah.
Great. We have a question about T-levels. What are people's views on T-levels? Anyone want to that?
Was it T-levels, did you say?
T-levels, yes, Ian, yes.
Interesting. I think it was today the government have announced they're going to pull back from defunding a number of the level 3 qualifications. Colleagues, you may be aware that the frustration we had for colleges really was that there weren't replacement programs, and this really affected some of the health and care programs. But and you can't recruit students to programs unless there is an alternative. And the T-level program is being rolled out, but we're not quite there yet. So we were really concerned around the health and social care. However, good news, the government has listened and it's pulling back on the defunding. So that means people have confidence to continue on those national programs. So I'll shut up because I can see Sam's going to come in and has probably got more knowledge on this than me. Sam.
Not necessarily more knowledge, Ian, just the fact that some of our employers have said that the students that have done T-levels have been better prepared, and actually they've really valued the student levels. So that's really lovely positive feedback for those students, and also then get the message over to parents who may be supporting young people choosing those options or not, because the placement opportunity is the thing that's been making a difference, which is great for the young people.
Well, thank you very much for those case studies and for answering that question. So there's some great examples of partnership working there. So thank you very much. Ian, do you want to say a few final words before we finish?
Well, happy to. I mean, I just want to thank all our speakers. Thank you so much for giving up your time, such excellent presentations. And I was very excited. I was making copious notes that I don't know what I'm going to do with now, but I'm sure somehow we'll get the slides, colleagues, out to everybody on the call. And no doubt you'll be thinking about what you can do if you're not already engaged in partnerships. There's a very rich resource there, I think, quite clearly that we can draw upon. And not only thanks to our colleagues today, but also those other colleges and universities that have joined with Councillor Deans in providing those case studies. I think all of us do our best to influence government on the importance of the health and social care sector and the investment. And it sounds a bit, I don't know, I would say this, wouldn't I, colleagues? But that FEHE relationship, what we're doing at a local level to fix it, despite all the barriers, all the complexities, all the bureaucracies, and how we get through it. And I don't know if it was Claire or Mandy, I think, mentioned somewhere along the line that it's about people, and people make it work. They get around this because there's that shared endeavour. And what comes across, I think, today is not only the passion and the commitment, but just wanting to make it work right for the students and right for the healthcare sector. James, I don't know if you want to sort of close out, because I mean, you opened it. Is there anything from a Councillor Dean's perspective you'd like to say?
All I was going to say is to echo all of that. I think you're spot on. It is about the people, and it's so great that despite so many of those barriers that I know that people come up against, actually hearing case studies like this, and I know countless others out there, really do inspire us. But I know also give ideas to others who are maybe experiencing challenges or who've gone through something similar, and let them know that they're not alone on this as well. So I always find these meetings so crucial for that. And I suppose the only thing I wanted to really close on is to say that this is far from the end from this discussion for us. I know that we'll be coming back to this. Our approach to this is not we do one webinar and that's that box ticked. We're really keen that we continue this discussion and we keep talking to members. So whether it's in this kind of format, whether it's at our in-person conferences or via our policy groups and nation groups as well, I know that we'll keep these discussions alive. So really looking forward to picking this up in the new year. And as Ian said, working together to learn from each other, but also look to influence governments across the UK as well to make sure that we can continue to make sure that students can benefit from this and that we get the health workforce that we need off the back of it as well. There's a really hard-headed side to this, which we know that governments need to listen to as well. So thank you so much, and thanks everyone for participating.
Yeah, I really should thank everyone again. So thanks everyone for contributing, and thanks to you for listening. And I look forward to seeing you on future webinars in the future. Well, as James said, this is very much on our agenda, so we'll be coming back to this in the new year. So thank you very much for listening and contributing. Goodbye.
Thanks, everybody. Goodbye, everyone. Thank you.